So today we are excited to welcome Rear Admiral Mike Parks, who after retiring from the U.S. Coast Guard, assumed the responsibilities in April of 2015 as Regional Executive of the Northern Ohio region of the American Red Cross. And in this capacity, he oversees 5 American Red Cross chapters covering 22 Northeast Ohio counties, serving 4.5 million people. During his 35-year Coast Guard career, he was deployed to help direct emergency responses following the devastating earthquake in Haiti and in response to Hurricane Katrina. From 2010 to 2013, he was based in Cleveland and served as the commander of the 9th Coast Guard District, responsible for leading and directing all Coast Guard operations throughout the 8-state Great Lakes region, including the 1,500-mile international border with Canada. Other significant assignments included the Deputy Director of Operations in Colorado Springs, Chief of Staff in the Coast Guard Atlantic area in Portsmouth, Virginia, and Chief of Staff, Chief of Operations in Cleveland before assuming the lead. He also completed tours of duty on 6 different Coast Guard cutters, commanding 4 of them. He is a graduate of the United States Coast Guard Academy and George Washington University, and was selected and attended the National War College in Washington, D.C. Probably the most proud thing he has accomplished, though, is being a graduate of the Leadership Cleveland class of 2017. Please welcome Mike.
Well, good afternoon, and Rachel, thank you for that much too kind introduction. Just every time I hear that, I just feel like I'm getting older and older. But thank you so much, and it's great to see some friends. And yes, of course, the only thing that's of note on that whole list is Leadership Cleveland 2017. Great to see some classmates, and great to see some former Coast Guard shipmates who have remained in the Northern Ohio area to continue to serve. So great to see you. Thank you for taking time. You must have had absolutely nothing else on your schedule today. So what I'm going to do is I'm going to jump through they say a picture's worth 1,000 words. So I'm going to try to reduce the word count and just increase the photo count. And we're going to just go through a bunch of slides real quickly. And that way you can kind of just save any questions you may have, and we'll take it from there. So obviously the mission of the American Red Cross, it really is about preventing and alleviating human suffering. And if I were to describe it in a word, I'd say it's really about caring. And I think that's really, when you get down to it, what the Red Cross is about. And so if I could, I'll just go through and talk about some of our services. These are the 5 lines of service here in the American Red Cross. That's most people know us for blood and mud, whether it's disaster relief or biomed, but we also, many people's Red Cross story starts with having learned CPR or swimming or a babysitting class. We do train life-saving training. We also have an international component. We've done some great work there. And obviously our service to the armed forces, which for those of you that might remember, you probably don't remember it because you weren't there in 1881 when Clara Barton, the angel of the battlefield from the Civil War, actually founded the American Red Cross based on her time working in both sides on the Civil War. She thought we needed a Red Cross, and she was actually our first CEO for more than 2 decades. So you talk about a woman who really broke the glass ceiling before there even was one. She's one of those people, when they say, who would you like to have lunch with? She comes to the top of my list. She's just an incredible human being. So I'm really proud to be, part of Clara's army. So here's a couple shots. This is at the East Palestine disaster that occurred last year. This was in Columbiana County. So I know many of us are in the Cleveland area. This is about as far away from us as you can get in our region. And I know Rachel mentioned 22 counties. It's actually expanded now. It's 31 counties, and it's 5.3 million people. We had a Red Cross shelter set up. You can see the picture there within 2 hours, and we were serving people food for those residents that were impacted and forced to evacuate. So that's something that we did for a number of days while until the residents were permitted back in their homes. So even in the farthest reaches, your Red Cross is there. Then a little closer to home, this is a shelter that we set up for the Terrace Towers in East Cleveland, where we had more than 130 residents evacuated due to a fire in the Terrace Towers. And these are just a picture of some of the volunteers that we have and staff that actually help us. We ended up housing the residents in a dormitory after we had our first initial sheltering operation. We did that for 6 nights until we got a more permanent solution. One of the parts about this that made this especially challenging is there were a lot of medical complications. And one of the things that really was heartwarming is our ability to reach out to our just incredible medical community here. University Hospital, for example, providing us nurses to help with all the medical care that these clients and the residents needed. So that was really something special. We provided in just this incident alone more than 2,000 meals. So that's just something that we did, plus more than 300 health services, something we do just here locally. Then on a large scale, sense, this is a photo of Hurricane Ian. Obviously, devastations down in Florida. But this is a picture. You can't see her, but this is one of our own Medina County volunteers giving what we do best, which is bringing hope through a hug. And we are, constantly, responding to disasters. And I might make a point. So large scale disasters, 40 years ago, we were experiencing 3 $1 billion disasters a year, 3. And last year, 2023, adjusted for inflation, we experienced 28 $1 billion disasters. So if that gives you any idea the magnitude of the challenges that we're trying to overcome, and we're still providing all the same level of services. So one of the things, that we do locally here is, home fire response. There are about 65,000 disasters every year that the Red Cross is involved in supporting. Most of those are indeed home fires. Here in Northern Ohio, we live in one of the second safest places in the country for natural disasters, but our home fires, 3 to 4 times every night, we are supporting, when the fire department leaves and that family is standing on the curb looking at a house like this in the upper right, we show up with our volunteers, like you see here, trying to help these people who've lost everything. We do this on average 3 to 4 times a day here in Northern Ohio. And last year we gave more than $1 million worth of direct client assistance, where we give them the opportunity to have a place to stay, get some food. And then as you see on the lower left, you'll see caseworkers, people, American Red Cross volunteers do just amazing work to help those people. One of the things we do in the community is preparedness is critical. And here you see a photo of one of the programs that actually started here in Cleveland more than 30 years ago, when we started a program called Operation Save a Life, where we gave out free smoke alarms. That program has morphed in the years, and now we install the smoke alarms with a partnership with our local fire departments and donors who provide us the funds so we can provide these free smoke alarms. Here in Northern Ohio, we've distributed and installed more than 250,000 alarms. This program, about 9-10 years ago, the organization said, hey, these guys in Cleveland got something going on, because we reduced the loss of life from 30 to 35 people a year into single digits. So what we did, the program went nationwide for the country. And so the Red Cross has now installed more than 2 million free alarms and saved more than 2,000 lives that we are that we even know about. So great program started here in Cleveland. This is a fun event that we do every year, thanks to our partners and the support of travel centers. These kids who lose everything in the home fire, they don't have a lot of holiday celebration, whether it's Christmas or Hanukkah or whatever they celebrate at the end of the year. So we do an annual toy giveaway in all 5 of our chapters. And this is something that's supported by one of our partners, travel centers. Their employees provide all of these gifts. And it is so rewarding to see these kids come in, and we got them broken down by age group, and they come in and their eyes light up, and we say, please go ahead. And, with their parents or guardians or whoever's with them, they do a little bit of a shopping spree, which is really, really rewarding to see. Obviously, we're known for blood. I mean, people constantly are telling me, I just heard from you, which is basically another way for them to say somebody called them about donating blood. And that's something that we do, 40% of the nation's blood supply is provided by the American Red Cross. We provide 95% of the clinic's blood here in Northern Ohio. This is one of those, critical things. And the number one reason people don't give blood is nobody asked them. And that's, that's a shame. That's just a travesty. So consider all of you who are on this call, you have now been asked, please donate blood. And you can do it every 56 days. It takes less than an hour. There's an app on your phone that streamlines it. It's great. Make an appointment, give blood. This one of the things that we're also trying to do is we're targeting our Black community to help in the sickle cell initiative, because that's something that is a tragic illness and a disease that impacts that community. And we just need to continue to get people because the blood transfused from a donor of the same ethnicity is certainly most compatible. So that's a program that we've got going on. If you can't give blood, if you can't donate blood, then maybe you find someone who can do it on your behalf. But big part of our job. Something else that we do, and as I said earlier, a lot of people's first portion of the Red Cross experience was really with our training services. In the picture here, you'll see the chairman of our Young Professionals Council, who is actually doing CPR training, and our whole Young Professionals Council got certified. And if you are not certified in first aid, CPR, and AED, please do. It's now a requirement for graduating high school in Ohio. And so if you feel like the certification is good for a couple of years, this is, never something that you should not be good at doing. So please think about this. We trained last year, I think we trained more than 50,000 people received life-saving CPR training. So really an important function. International services, we obviously have a big footprint in the entire world. This is a photo here of one of our folks on the left. She is from the Mahoning Valley. She's actually from the Youngstown area, and she's fantastic. She was in Zambia, and one of the big programs we've had is we've really helped eradicate measles from the globe based on a program that we started years and years ago. Those are the kind of things we do internationally. Also, a picture on the right is one of our volunteers out of Stark County who flew to Guam, which, by the way, if any of you have ever flown over to Guam, that is not an easy flight. That is not for the faint of heart. Many hours to get there, but he was there to help respond to Typhoon Mawar. So just yet another example of what we do, not just here at home or in the nation, but around the world as a global enterprise. Service to the armed forces. This is kind of how we started, like I said, on the battlefields of the Civil War. This is part of our animal visitation program. These little pooches, our Red Cross volunteers, these are trained service animals, and we bring them into VAs and other facilities. I'll tell you what, it really helps our veterans. It really helps the people that they interact with. It's a great program. And, we have something called the Hero Care Network, where when you are deployed and you need something back home, someone's ill, or there's going to be a birth or regrettably an illness or a death, people work with us, with the American Red Cross and our Hero Care Network, and we work with the people, the battlefield commander, so to speak, or the shipboard commander, and get the people home to their families. That's something I personally experienced in my Red Cross life multiple times, bringing people, shipmates home. So in closing, I'll just say, before we open it up for questions, I'll just say volunteers are the lifeblood of the organization. This is one of those things. What didn't you know when you got to the Red Cross? Well, this is one of them. I didn't realize that 90% of what we do is done by the Red Cross. We have 54 paid staff here in Northern Ohio, covering those 31 counties, but we have more than 2,000 volunteers that do the job each and every day. They are just incredible. Whether they're responding to disasters or they're donor ambassadors helping us with a blood drive, whether they're helping drive to move the blood to the hospitals, because once we collect it, the hospitals need it. or they help those service members as caseworkers. These are all really, really important opportunities. Anyone's interested in, giving back, it's a great way to do it. And so with that, I will open it up to any questions, open shot on goal. And, there's enough of my compadres here, that I can punt to if I need to.
Mike, thank you. I think it's the breadth of all that you offer here is, I think many might not know that the Red Cross provides so many services. So thank you for sharing that. You mentioned so much in this work that there's partners that you work with on the disasters in the day-to-day work. Who do you work with most, and how do you effectively collaborate, especially in a time of a disaster?
Well, obviously, Rachel, that depends on the nature of the disaster. I think, for national, big, what we would call a level 6 Hurricane Harvey, or the wildfires out in Hawaii, or Hurricane Ian. We do a lot of work with FEMA. We do the Federal Emergency Management Agency. We also work obviously with all the local state officials, the emergency managers. Back here home locally, we work very, very closely with our fire departments and our emergency managers in the counties. We kind of work county by county, but municipality by municipality. And we really work hard to have great relationships with our first responders. We couldn't do our job without them. We try to provide as much support to them as possible. We'll do things like call canteening, even if it's not a fire, maybe it's another activity where there's a lot of first responders gathered. We'll try to help them. And so we'll work with them, but we also partner with whether it's places like the City Mission or the Salvation Army or the food bank, depending on what the requirement is. We have and that's one of the greatest things about being here in Northern Ohio. There's such a robust nonprofit community that is so involved, and we really, the leaders of those groups are really very integrated, and I'm blessed to be able to consider a lot of those leaders good friends.
Are there any partnerships that you are currently seeking to help fill any service gaps that you may have?
There's never, that's a great question. We've got a lot of great partnerships, but we never have enough. I've been asked, what are your 3 biggest challenges? And I always say mission capacity, because of everything we do that's, volunteer based. Getting more volunteers is obviously probably our biggest need. People to volunteer for any number of the different opportunities that we have. It's not all of it is like a commercial off the shelf. Our great partners at the food bank, we could all go volunteer there this afternoon if we could set it up, and we could have a great experience. A lot of our volunteer opportunities aren't exactly the same. We're asking you to potentially go out and help people at their most vulnerable. We're giving you accountable, dollars to do that with. And so that's a challenge. But I think, volunteers is one of our biggest needs. Obviously, revenue is a big challenge. Anybody who had some spare change wants to check their seat cushions, that's something that obviously can't meet mission without margin. And I would say about that, I thought another one of the things I learned about the Red Cross is it's not funded by the American government. There's no congressional appropriation. We based, as you saw in our mission slide, the generosity of our donors, whether we get the breakdown from individuals or corporations or foundations. That is how we do. We cannot meet mission without margin. And then obviously, sharing our story. This is a great opportunity to tell more people, about what we do, and hopefully you'll continue to pay that forward.
Through the volunteering, since so much of it might be based on what's happening, are there opportunities for organizations to partner with Red Cross to have service opportunities for their employees?
Most definitely. One of the things that comes to mind immediately, Rachel, is our Sound the Alarm program, where we do this now. Corporations, organizations want to partner with us. We've done it with from Key Bank to the VA to Wounded Warriors. We do it with all different groups of people who may want to partner, with us to install these smoke alarms. We don't, some companies bring in 50 people and we have a huge event. Others have 4 or 5 and we push them together and we have an event somewhere, around the community. And we really focus on those at-risk communities. But that's a great opportunity. You don't have to have any training. We show up usually on a weekend, like a Saturday, and maybe we'll try to bribe you with some donuts or some pizza, but then we end up giving you about a 15-minute tutorial on how to approach these people. People are wearing Red Cross vests. We're working with our local partners in the fire department, and off we go, and we install these free smoke alarms, and it's a great program. And part of it's the education piece too. It isn't just about the alarms. It's about spending those few minutes with the people, telling them, did you only know you got 2 minutes to get out of your house? Do you know that most fires start in the kitchen? So your, fire extinguisher in your basement's not helping you much, those kind of things.
Now, you had mentioned that Northern Ohio is the second safest place in the country for natural disasters. Where is the safest?
Upstate New York, Syracuse. And see, they get a lot of snow up there, lake effect snow, but they have plows that they actually use. So, it works. I can say that since I'm from upstate New York.
So thinking about the data that you shared about increasing disasters over the years, how are you managing the growth of the Red Cross when the needs just keep growing?
I think that is the 64,000 or add zeros dollar question to that. I would tell you that is our challenge. But I think, the organization is working very hard to stay more and more engaged in the community. We don't have enough resources to do it ourselves. Now we have some great partnerships, but our partners are strained too. So really what we need to try to find is more community resilience. We need to find communities, not that are necessarily organizations, but people who are willing to step up, whether that's the faith-based community or other organizations. We have some great relationships with some of the CDCs, the community development corporations, to try to get some of the local influencers, because we all live in communities where there's somebody who, if they ask you to do something, you're going to do it. We all know that. We can all probably pick that person. Well, we need to get those people on our side and have them help promote what we're doing, not as much about promoting the Red Cross as promoting the community resilience, so we can help them in places like health and housing and hunger. And so we're trying to find ways to do that. The organization is embarked on a program where we really are trying to become even more community centric and really recruit those people that are available that can help us move the needle on the mission.
Mike, what drew you to the Red Cross after your retirement from the Coast Guard?
Well, I'd like to say, I had a grand plan, but I really didn't. And it was very, I'm going to be entering my 10th year next month, and it was really providential. I think I really didn't fully appreciate all that the Red Cross does or did at the time. I have a Red Cross story that talks about all 5 of those missionaries we talked about earlier, but I never really paid attention to that. But I do know, and I really do believe it is the world's premier humanitarian organization. And I've been very blessed. I retired from the Coast Guard, but I was still, now I guess I could say I was young since I'm 10 years older. But I feel like I had a lot of energy and a lot of gas in the tank. And to those who much is given, much is expected. And I feel like I've had an opportunity to continue. And it's really not work when you love what you're doing and you love the people you do it with. We've got a wonderful team. The volunteers are, just tremendously inspiring. And, I was, during my interview process, I asked, would I be deploying at all because of my background? And the president of Humanitarian Services, my boss's boss in DC, basically said, no, Mike, that's not happening. We're not doing that anymore. So I counted up the other day, 10 deployments later. So, and I challenged him on that a few years ago. I said, hey, what's up with this? He said, well, Mike, things change. And so, but not the one thing that, the Red Cross is not your father's Red Cross, but one thing that hasn't changed, Rachel, is this is an incredible organization that brings good hope, help everywhere it goes all the time. Do we get it right all the time? Of course not. Do we have areas for improvement? Sure, just like any organization, because we're made up of people and there are no perfect people. But that said, I'll tell you what, I love this organization and I am excited to be associated with it.
And can you share some thoughts on what that transition was like from leading in the military space to leading an organization that is driven so much by the work of volunteers?
Wow. Well, I think, a couple things, to be completely transparent. Um, the United States Coast Guard probably at the time might have been about 65% male. Red Cross, 65 to 70% female. So that's a bit of a cultural difference. Now, I'd like to think I was somewhat empathetic, but that was not my, I didn't usually lead with that. Now I lead with that. And I quickly determined that there's a lot more empathy and compassion in this organization, even though both, the Coast Guard's a humanitarian organization saving lives and, enforcing laws and treaties and things like that. But this is just a very different thing. And, the other big difference I would tell you is the Coast Guard has this thing called the Coast Guard Auxiliary, which is the civilian arm of the Coast Guard, does a lot of great work on the water, a lot of boating safety things. But if you took the civilian, volunteers out of the Coast Guard would continue to exist. It would continue to do a great job. Yeah, there'd be a loss of capacity, but we would get through. If you did away with the volunteers and the Red Cross, there'd be no Red Cross. Flat out. It would cease to exist as we know it today. That's how vitally important. I was just in a room about an hour ago, 2 staff members and a volunteer, and the volunteer I'll let you go. I know you have important things to do. And I said, you're the most important person in this room. And there was no doubt about that. And the 2 staff members said, you are, because we can't do our job without them. So that has been a bit of an adjustment. I think the other thing that's an adjustment is, we're having to raise funds. I did not have any experience in that space. I didn't even do well selling Amway as a Boy Scout. So, that was not my sweet spot. But I'm not raising money for me. I think raising money for this mission is critically important. I didn't have to do that in the Coast Guard. I mean, I had to make sure that we were good stewards of the taxpayer dollar. But even when we didn't get a budget, I knew I still had a job and I was still going to go out and save lives and enforce laws and treaties. Here, we need to meet mission through margin. We got to get that, to help we're still helping 4,000 people, survivors in Hawaii right now. They're in 14 non-congregate shelters and we're feeding them 3 meals a day.
So, Mike, as you look ahead for the next 5 years, what is your vision for the Northern Ohio region?
Wow, that's a great question. And we don't have time to answer that to the fullest extent, but I would tell you in a snapshot, the answer to that, Rachel, is that we really want to figure out how to leverage our community partnerships to really continue to be a more vibrant partner in these communities so we can best serve, 31 counties. Well, if you think about Cuyahoga County alone is 59 municipalities. So start doing the math. How many different groups we have to be, in touch with and able to work with, whether it's, having partnerships with schools so we have a shelter when we need one, or some big accident or some train derailment, where we're out in the middle of, the country trying to help people. That's I think what we need to be able to do is be able to continue to expand our reach through our partnerships, through the community engagement model that I discussed earlier. I think that is, we need to keep doing what we're doing every day. So this is a do what we're doing now, and that's our vision going forward.
Well, Mike, we are thankful for you, your team, and your host of volunteers who are making such a difference in our community and supporting people in their time of need. And thank you for being here today to share all that you do.